So next we'll look at the AP joint glides and mobilizations in external rotation. So similarly, when we were looking at them, excuse me, in neutral, now what we can do too is assess the glenohumeral joint APs and mobilize into external rotation. So you can use your leg as a supportive surface. I'm using my thigh. Then again, notice the elbow is a little bit higher than the level of the shoulder, just so the humeral head sits better in the glenoid. And here with my right hand, you can look and see at which point of external rotation you want to assess for joint mobility. So let's say Dr. Diaz has some restrictions. I get him into external rotation. He says, oh, I'm stiff here, or that's pretty good there. So I can assess him. He's in about, well, maybe 30, 45 degrees of external rotation. Similar handling in that with my left hand, I'm going to find the AC joint, the end, and I'm going to slide over a little bit more laterally with the hypothena part of my left hand. And then I'm going to push in a posterior lateral direction. So if you notice the orientation of my forearm, I'm going posterior lateral, take up the slack of the tissue, find R1, R2, R1, oops, R1, R2. When you can gradually increase the amount of external rotation as you continue to assess the stiffness of the joint. As you wind up the joint, R1, R2, R1 is going to come on a lot quicker, as well as R2. And then from here, you can do your respective joint mobs. So again, if it's a grade 3 minus, that would be 25% through resistance, take up the tissue slack. R1, 25% through resistance, and your mobilizations from there. So this is the assessment and mobilization of the glenohumeral joint in external rotation.